Hi friends, on today's video we are going to see about the congenital heart disease, and it is a cyanotic congenital heart disease. Let us see about coarctation of aorta. Coarctation of aorta. So usually we will start with the model of heart. So let us start itself. And left atrium, left ventricle, aorta, it is present here. Right atrium, right ventricle, and the pulmonary artery which connects the lung for oxygenation. Where the oxygenation take place, gas exchange take place, and from right ventricle, from the lung, the pulmonary vein is connected to the left atrium. Okay, so we should know normally in a fetal life, when we are in the mother's womb, there is no lung. So how we will be able to respire and breathe, and how we get oxygenated blood? Why? So because normally when we are in a mother womb, there is no lungs. The lung become constricted, and hence I will constrict the lung now. Okay. So I will constrict the lung. The lung is too short now. Okay. And here there is one structure known as Ductus Arteriosus. Okay, the Ductus Arteriosus connects the it connects the pulmonary artery and the aorta. Here the Ductus Arteriosus is present. So from that time, so the umbilical vein receives oxygenated blood from the mother, and it supports and give throughout the fetus body. Okay, the lung is constricted in the fetus life. When we after birth, the lung become expanded and contraction expansion take places. So in this way the ductus arteriosus here closes spontaneously. Okay, and the lung become enlarged and it starts its function. Oxygenation and carbon dioxide exchange take place. So if it is not closed after birth, what happens? The lung it doesn't constrict, it doesn't expand, it become constricted. So what happens? We can able to rectify this correction. We can able to rectify. Okay. So now what is coarctation of aorta? Coarctation of aorta is nothing but narrowing of aorta. The aorta here, so this is a normal aorta, but in the coarctation of aorta, it becomes, see, if this is a normal, it becomes like this. Okay, it becomes narrowed. Okay, so this causes some defects. So we can see what happens here. There are three types. Okay, three structures positioned here. The first thing will be post-ductal, pre-ductal and ductal. First, pre-ductal. So this is a ductal. If the coarctation or narrowing happened proximal to the ductus arteriosus. So if this is a ductus arteriosus, it happens here. Means it is a pre-ductal type. Pre-ductal type. Ductal type means it origins here. Okay, if the narrowed happens like this here on the ductal, in the origin of the ductal, which is known as ductal type. Okay, and if it occurs here, the narrowing occurs here, it is known as post-ductal because it is distal from the ductus arteriosus. So post-ductal. So these are the three types we should know about it. Okay. Now the origin of the ductus arteriosus is known as juxtaductal. Okay, juxtaductal. Now what are the etiology? How it causes? The first thing we should know here is it is caused due to inadequate uterine supply. If inadequate uterine blood supply occurs in the mother womb, coarctation of aorta can be caused. Or it can be occurred due to development of any hemodynamic disturbances. Okay, hemodynamic disturbance. Okay, so these are the causes. And if any migration of smooth muscle cells, so in arteriosus, ductus arteriosus, there will be a smooth muscle presented here. Okay, some smooth muscle, it become migrated in sometimes. So when migration of smooth muscle take place in the ductus arteriosus, coarctation of aorta can be caused. Migration of smooth muscle cells. Okay, so these are the causes of coarctation of aorta. What happens in pathogenicity? Listen, when pathogenesis, see, if the stenosis or narrowing take place here, the blood won't move forward to reaches the tissue and produce them a nutrient and oxygen and something what. So if the narrowing happens here, there will be a backflow. The blood won't move to the normal way and it leads to the backflow. Left ventricular hypertrophy will be there. Left ventricular hypertrophy will be there. Left atrium pressure will be more because more amount of blood are accumulating here itself and not moving forward, and the blood will be getting sufficiently accumulated here. Okay, and there will be a right heart failure. Right atrium pressure will be there. So it causes a congestive cardiac failure. There will be a narrowing of the aorta, and what happens? The blood will not move forward to supply the tissues and other organs, and hence it get accumulated in the same place, getting hypertrophied. Okay, so this is what happened and causes a congenital cardiac failure. The symptoms in this coarctation of aorta will be fatigue. Okay, fatigue due to loss of cardiac output, dyspnea, and then we have dizziness, hallucination, epistaxis. These are all present. These are the featured symptoms which is present in coarctation of aorta. Now signs. Coming to signs, see, we should remember that if proximally narrowed take place, proximal stenosis take place, the blood pressure will be more on the upper extremities. If distal stenosis take place, the blood pressure will be low in the distal part. Understand? So more blood pressure if proximal stenosis happens and low blood pressure if distal stenosis happens. So on the proximal side, increased blood pressure, and on the distal side we have decreased blood pressure, and there will be a delay on the radial pulse and femoral pulse. Okay, there will not be a same one. Okay, same blood pressure, blood amount, pressure will be not be normal at the two parts, radial and femoral. So it will be differentiated. Radial pulse will be more and femoral pulse will be less. Okay, femoral pulse. So delayed pulse on the radial and femoral artery. And then on diagnosis, coming to diagnosis, ECG. In ECG we can see left ventricular hypertrophy. Left ventricular hypertrophy can be seen. On X-ray we can able to see the dilated left atrium and enlarged left atrium can be seen. Okay, dilated left ventricle and left atrium. On echo we can see stenosis and lesions can be seen. This is the diagnosis which doctors can refer at. And at last on treatment. On treatment we have medical management and surgical management. On medical management we can give inotropes, inotropic agents. Diuretics can be given and prostaglandin infusion. So if prostaglandin is given, we can able to move the blood through the ductus arteriosus and to the aorta. If lung is not constricted, we can able to give the blood, supply the blood through this ductus arteriosus way. So to dilate more the ductus arteriosus, we can use prostaglandins infusion. On surgical treatment, we can use percutaneous balloon angioplasty. If any narrow take place due to any accumulation of calcium or fatty acid, we can remove that thing by inflating a balloon. Okay, and we can valvectomy can be done. Valvectomy can be done. So this is about coarctation of aorta. If you have any doubts, comment on the comment box. Until then, this is Nandu. Take care, be safe, and bye.